Well, welcome back. We spent a little bit of time in our last session talking about storytelling and how the ancient Greeks gave us the gift of this five-part story structure. We have an exposition, rising action that reaches a climax, then falling action, and a conclusion where life is different in the conclusion than it was at the beginning. And so we talked about this five-part Greek structure with the illustration of the three little pigs as a benchmark for thinking about your own D&P manuscript story. Because just like in this five-part Greek structure, your D&P manuscript is similarly constructed. So when you think about the three little pigs and how it's memorable, how you can see the characters, you can remember the sequence of action, think about your D&P manuscript in the same way. You want to craft a story for your practice transformation that sticks in the mind of your reviewer and sticks in the mind of your reading audience so that they adopt or use or build on the evidence that you discover in your work. So when you think about a classic manuscript structure, and certainly there are lots of variations on the theme, but the classic structure is you have an introduction section, methods, results, discussion, and a small section on conclusions within the discussion section. So it's a four-part structure, but the key elements follow this ancient Greek narrative arc in a very similar way. So your introduction section tells you essentially three things. First, what is known about the topic or issue that you're writing about? So what have others written about? What's the evidence from scholarship? What's the evidence from practice in your own setting? So that's what is known. And then it's followed by what is not known about the issue or the practice. And that leads you then to the statement of the purpose of your paper or the gap. What's the problem? What's the issue that you're going to fill? What the gap between what we do know and what we don't know is essentially the purpose of your manuscript. You're trying to fill this gap in knowledge and in practice. That introduction drives you directly to the methods section. In the methods section, you're going to summarize the design of your project or your intervention. What are you doing? How are you doing it? Then you're going to say, how will you analyze the information or data you gather from your work? The method of what you are doing in your design and your analysis is meant to fill the gap that you identified at the end of the introduction section. So you can see the introduction is intimately linked to the method, which then drives the reader to the results section. In the results section, you're looking at your aims. What do you intend to achieve through the methods that you've created? And then your main result could be seen as like the climax of your manuscript, the key finding. In the discussion, this is like the falling action in the Three Little Pigs, where things begin to wrap up and reach new conclusions, new ways of being. So in the discussion section, you're going to say, what's the meaning of your primary aim? How did your manuscript, how did your work fill the gap between what was known and what wasn't known? And then at the end, you're saying, what's the future? What's the extension of your work? What are the limitations? So what does it mean that you found this result of your primary aim? And then in the conclusion, it's usually one small paragraph at the end of the discussion section that pulls in how you have closed the gap that you identified in the introduction section. So when you think about these sections of a manuscript, it forms a narrative arc. You've told the reader what's already known in scholarship and practice, what's the best evidence, what's currently happening on this issue, and then you identify the gap. That's what you use to hook your reader in to care about your manuscript. Why should they bother reading what you've done unless you're bringing something new and innovative to the scene? That gap or the problem statement then drives your design, your analysis, your results. Your results are what you found when you implemented your methods, which were implemented in order to close the gap. And so when you get to the discussion section and you're saying, here's the meaning of what I found for my primary aim. Here's how I filled the gap. Here's the implications for practice, for populations, for policy, for research. So what? That's your discussion section. And then you're helping the reader to see, why should the world be different because of what you've done? Giving them a picture of that future state that lies ahead, because you've discovered something new. You've discovered something of applying a particular method in a particular setting and helping to improve the patient care, the population well-being in your own practice setting. So that's the overview of what your manuscript is designed to achieve. When you get lost and you're stuck in the details of editing and drafting your manuscript, come back to the Three Little Pigs. Come back to this narrative arc. You're trying to tell the story. What do we know about the practice problem or issue? What do we not know? And then what is the gap, and what are you going to do to close that gap? That's your introduction. Then your methods is the first part of this rising action. You've identified the challenge and the gap. Now, what are you going to do to fill it? Usually, you start with an overview of your methodology. Are you randomizing patients to receive different interventions? Are you reviewing routinely collected data? Are you doing interviews? What is your intention of how you're going to close this gap? That's summarized with your overview. Then you talk about your setting, your practice setting, the patients, the population. Are you pulling people out of a larger population to study them? Are you studying everybody in a unit? That's your setting. Then your project design. Are you just observing what people do? Are you using a PDSA cycle to improve practice on cancer screening? Are you using a specific tool to measure depression? All of that comes in your project design. And then when you implement that design, you get data. The methods section says, how will you analyze the data once you have them? It doesn't say any results at all, just what will you do? We will apply logistic regression to estimate, to predict factors that are covariates of readmission within 30 days at Emory University Hospital. We will use grounded theory, qualitative analysis to understand participant experience with post-traumatic stress disorder. That's your analysis method. How will you do it? Comes in methods. And usually you conclude by saying how you're protecting the ethics and the well-being of your participants. Then you get to the results. Typically you start with the demographic characteristics of your patient population or your unit, and then you have the results for your primary aim and your secondary aim. And that then is the pinnacle of your work, is what did you find in this primary aim? The discussion section is then going to lead your reader into understanding the meaning of what you found. This is where you interpret, so what does it mean that I discovered this? Then you may have secondary meanings, implications, extensions. How will you use this in practice? How will you use it in policy? How will you use it in research? And then what should be different in the future based on what I've found, and what are limitations of my work? Everybody has limitations, and you acknowledge them. Talk about strategy used to mitigate them here. The resolution comes when you explain, so what? In that last paragraph, you want to hit hard. You want to punch the reader with why the work that you did matters. That's the overview of your entire DNP manuscript. There's certainly variations on a theme. Quality improvement papers are going to have some differences compared to qualitative research with interviews, compared to qualitative research with focus groups, compared to chart reviews. But these concepts are relatively transferable across those paper types, those manuscript types. You're identifying a gap. you are then going to fill the gap with your methods, the results that you then take to the discussion where you tell the reader, so what does it matter that I found this, and how should the future be different because of the work that I've done? So that's how you need to think about crafting this manuscript. Your abstract is essentially a condensing of the introduction, methods, results, and discussion sections. So I'll give you 2 case examples. One is from one of your colleagues who looked at are certified nurse midwife attended births in Texas hospitals underreported. So this is someone who preceded you in the program. And in their work, they looked at what was known about midwifery documented deliveries. They used particular methods to gather data about midwifery attended deliveries. And they described the gap between nationally reported data and actual practice in the state of Texas using a very large sample. And they made recommendations about how the future of midwifery reported birth should be different. In case 2, it looked at something called signal functions. These are ways to measure a facility's ability to manage obstetric emergencies in low and middle income country contexts. So this manuscript looked at the current signal function estimates of the ability of facilities to manage infection. So in this case, sepsis or infection for the mother. The signal functions estimated a 92% ability in this context to manage the emergency. And the clinical cascade method estimated 40% ability to manage those emergencies. So you can see there's a huge gap between the standard approach and the cascade approach. And that was true across emergencies. And secondarily, so that was the primary aim, to measure practical ability to measure emergencies versus standard measurement technique. A secondary aim was to estimate how that ability to manage emergencies is lost from identifying the emergency, treating it, and then adjusting therapy as needed. So the secondary message of that manuscript is that there's a cascading loss of capacity for emergency obstetric management. It identified what was known about the issue. It had a cross-sectional data collection method. The results showed the gap between the cascade and the signal function and the cascading loss by emergency. Talks about the meaning of this finding for global emergency obstetric practice and provided suggestions for a better future state. So you can see that follows the same narrative arc of the ancient Greek narrative, but it's applied in a scientific context. So as you think about your own work, think about the background, what's known, how are you going to fill the gap that's identified at the narrative hook where you get them engaged in your work. How are you going to then explain your methods and results to improve the world with a better future state? So have a great time thinking about framing your work. There are templates on the course website to help you think through these things. For example, the manuscript outline that's due on January 29th has a template to help guide you as you think through these issues for your own manuscript. So that template uses the same structure as the ancient Greek narrative that we talked about, using the introduction, methods, results, discussion section, and gives you some key topics to address under each section. If you bullet point these key issues from this template, you'll be well on your way to a terse, succinct, powerful outline of your entire manuscript. And then on page 2 of that template, it gives you some ideas of how to convert that overall manuscript into a very focused abstract with introduction, methods, results, and discussion. So use these storytelling techniques to punch your audience with a powerful message.